And so I want to turn it over to Andrea so she can tell you a little bit about her professional expertise and what she's bringing to the table. So Andrea, please.
Great. Can you guys all hear me?
Yes.
Okay, great. If you guys have chats or questions that we'll address, please type those into the chat box. I know there's a bit of a clicking noise that's somewhat annoying. Kathy, can you try muting your audio?
Sure.
See if that helps. That was it.
It might be the fish tank, and there's nothing I can do about that, or they will die. So that's the only thing I can think.
All right. Well, I think muting will be a great solution, and then we'll just have to deal with it periodically. So thanks for having me. My name's Andrea Love. I have a PhD in microbiology and immunology. My research focused on host immune response to infection, and that was particularly with regard to human pathogens. So I've dealt a lot with these types of infectious diseases over the years. I currently work for a biotechnology company that works in a variety of different research sectors, including virology, infectious disease, immunology, immuno-oncology. And I also freelance as a consultant for a public health firm. And part of what's been on everybody's minds is, how to deal with the COVID-19 outbreak. What are the best precautions? Are these things really necessary? And so Kathy and I decided that it might be a good idea just to kind of give everybody a bit of an overview, address any of the concerns, there's a lot of misinformation out there. There's a lot of, people that are making claims that may or may not be accurate. So it's just a great opportunity to kind of go through that. So I'm just going to give a quick overview of some of the terminology because I think there's a lot of confusion sometimes. So coronaviruses are a very broad family of viruses. There are now 7 of them that are known to cause disease in humans. 4 of them are known to cause mild respiratory illness in humans, and we typically lump that into the category of having a cold. This includes 4 of these coronaviruses. It also includes things like rhinoviruses, and there's other respiratory illnesses that can cause various types of what we call colds in our everyday practice. 2 more recent or more novel coronaviruses were MERS coronavirus, which was in 2009, and then SARS coronavirus, which was in 2002 into 2003. These were, again, situations where they were brand new to humans. They caused significant outbreaks. They were not full pandemics, but they were significant disease outbreaks, and obviously public health concerns. The newest one that we're going to talk about today is called SARS coronavirus 2. So SARS is an abbreviation that stands for severe acute respiratory syndrome because it causes obviously pneumonia and respiratory illness. Coronavirus is obviously the family that it sits in, and 2 because the previous one in 2002 was called SARS coronavirus 1. This particular virus causes what we're calling it COVID-19. COVID-19 stands for coronavirus disease 19. 19 is 2019, which relates to the year that it was actually discovered in China and the initial outbreak. So this was discovered in 2019. It's an RNA virus, and what that means is that the genetic material, unlike with humans, which our genetic material is made up of DNA, made up of another molecule called RNA. And that molecule, because it actually immediately is made into all of the things that the virus needs for survival, is very prone to mutation. So the working theory of how this was able to actually start to infect humans is that there is a very similarly related virus in other mammals. Right now, the theory is either bats or pangolins, and this was able to mutate and jump into humans and start infecting humans. This currently is classified as a droplet transmission. So this is person-to-person spread through droplets. And what that means is when you cough, when you sneeze, when you breathe, or when you talk, small droplets of moisture that contain viral particles can be spread to another person. And this can be directly to a person if you're in close proximity, or it can be to an inanimate object or surface. Once it gets on that surface, it has a somewhat long time that it can actually survive on that surface. We'll talk a little bit about that in a little bit. But from there, another person can pick it up either with their hand or with something, another object. And if they put their hands on their face or near their nose or things like that, the virus is able to get in that way. The other transmission method is what we call fomite transmission. And fomites are non-human objects that can serve as basically a transmission point. So typically they're inanimate objects. I know there's been some articles in the news about dogs getting infected with coronavirus. This is more likely they were serving as a fomite. They were in contact with an infected person. They picked up the virus on their nose. Maybe they touched a tabletop that had some virus sitting there. And so they're currently serving as what we call a reservoir for that, or a fomite, where a person could actually touch them, pet their dog, let the dog kiss their face, whatever the case happens to be, and then get infected that way. Those are the two current methods of transmission for the virus. There's been some buzz that it might be airborne, but the data suggests right now that it's not truly airborne. And I'll talk a little bit about that in a minute. There's also some data that suggests that it can survive during the fecal oral route. So there's been some data that has shown that you can detect viral DNA or viral RNA in feces up to 11 days. So we just want to be careful. We're maintaining those hygiene practices. This is probably less of a concern for us in the United States, but in other countries that have limited hygiene practices or less access to plumbing and public water, it obviously can be a concern. There haven't been any cases that have been confirmed to be through fecal oral route, but it's just something to be aware of. We just want to be making sure that we're practicing hygiene all the time. So a lot of buzz has come about all the social distancing, about all the shelter in place, about all of the lockdowns, the non-essential business closures and things like that. And a lot of people are wondering, is this really necessary? And from a public health perspective, the coronavirus outbreak is particularly challenging because it is a novel virus. So unlike other things that we encounter every year or year over year, like influenza, like other types of common colds, other types of respiratory issues, we don't have any herd immunity to this virus. And what that means is that there isn't a proportion of our population walking around that are already protected from it. And so that means that every single person in our communities are susceptible to getting infected. And we don't have a vaccine. So we can't protect people by inducing immunity through a vaccination procedure. So the challenge becomes, how do you limit that when you have no protective abilities against it? And so that's why we are implementing social distancing. So the best practice is vaccination. Short of that, treatment options are great, but they're still not going to stop the spread. They're only going to help people who are already sick. So short of vaccination, social distancing is the way to go. Because what that's going to do is it's going to limit that exponential spread of the virus. One of the challenges with this virus, with COVID-19 disease, versus something like influenza in particular, is that it has a longer incubation period. That incubation period can be up to 14 days. The average is about 5 days. So what that means is when you get infected, you're going to be asymptomatic for up to 14 days while that virus is in your respiratory tract, replicating, reproducing, making more virus, getting ready to spread. And you could be walking around, you could go to the grocery store, you can go to the pharmacy, you can go hang out with your friends, and you can be spreading virus as you're breathing on them, as you're talking closely to them, as you're interacting with them, and not even know it. And so a lot of people are like, well, I don't feel sick, I'm not sick, I don't need to stay home. And the problem is that you can actually be very contagious during that incubation period and not even know it. Influenza has a very short incubation period. It's only about 48 hours at the max. And so people with influenza, or people who are incubating that virus, are going to get sick pretty quickly. And so there's a lot less risk of exponential exposure in that case, coupled with the fact that we do have a vaccine for that. And we do have, treatment options for people that get very severely ill with that. The other thing that I want to talk about is what we call the R naught value. And what this means, or R0 value, this is from an infected person, how many people can that person go on and infect? And this is going to tie back into the fact that the data doesn't support airborne transmission yet. And so for something like SARS-CoV right now, the R0 value is estimated to be about 2.3. And what that means is for every single person that has coronavirus infection, they can go and infect 2.3 people from a single interaction. And that those next 2.3 people can go infect 2.3 more people each and 2.3 more people each and so on and so forth. So that becomes very exponential very quickly. This is in contrast to something like influenza, and I'm just going to double check. Influenza has an R0 value of about 1.2, so it's a little bit less. They're both respiratory illnesses. They're both transmitted by droplet. These lower values, something like a 2.3 or a 1.2, they suggest that they're not airborne because they're requiring close contact. Something that is airborne, as a really key example, is measles. So the measles virus is an airborne transmitted pathogen. It has an R0 value of 18, meaning one person can infect 18 people in a single interaction. So that's typically what you're going to see with an airborne pathogen. They're very, very highly infectious because they can basically free float in the air. They're not in larger droplets. The droplets aren't dragged down by gravity, and they're just kind of hanging out for the next person to walk by and breathe them in. Obviously, it doesn't exclude the potential that this could be airborne or could be semi-airborne in the scientific context. But as of right now, we want to just assume that it's droplet and fomite for the most part. And that's why the general recommendation is 6 feet away from another person, because that's going to be kind of the distance of a droplet spread. Okay. Typically, once you're infected, there's a broad array of symptoms. So this is very challenging, and I know a lot of people are very concerned about the inability to get testing done. So with the symptoms, the most common symptom is fever. From there, you also have things like a dry cough. You also have symptoms like lethargy. There have been reports of GI symptoms, so GI upset, diarrhea, other sorts of conditions. We do have some people that progress into that pneumonia and into acute respiratory distress syndrome. Those are much more severe cases. About 80% of the cases right now are what we're classifying as mild to moderate. These are going to be ones that you can typically treat at home with just symptom alleviating things. We're recommending Tylenol right now as a fever reducer and pain reliever. So if you think you're sick, if you think you have symptoms that are consistent with it, call your doctor or call the emergency med or call urgent care. Do not show up. When you show up, you're diverting resources from the really severely sick, and you're also potentially exposing other people. So call first. Every state and actually most counties, I know Delaware County doesn't have a health department, but we're collaborating now with Chester County. But even the State Department of Health, there's a hotline. If you Google search that, there's a hotline for COVID-19. They'll help direct you. If you qualify for a test, they'll also help direct you on where to get a test. Best practice, if you think you've been exposed or someone you interacted with now is testing positive or now has been quarantined because they're also sick, you want to also quarantine. And of course, you want to stay as far away from the rest of your immediate family unit as well. It's inevitable that the people we live with may ultimately get exposed, but we want to try and limit that if we are suspected of an exposure. So staying home, that's a mandatory quarantine. That's not even going to the grocery store. That's not going to the pharmacy. That is not leaving your house after that 14-day window. So it's a 14-day quarantine. If you suspect you've been in contact with somebody with COVID-19, or if you suspect you are also infected. And again, call the doctor first. They'll help direct you. There are not enough tests for everybody, so they're really required to triage people really carefully. One of the reasons why they're not doing as many tests as they should, and ultimately there's a variety of failures on that. We can get into that later. But there aren't enough tests. It's just the fact of the matter. There also are not enough PPE. So those are personal protective equipment for your healthcare workers. Every time they do a test on somebody, they need a new and clean set of PPE. So that's a mask, gloves, gown, etc. Every time they test somebody, they have to discard that set of PPE. So doing more tests is going through the PPE they need to treat the very severely ill. So again, For most people, it's going to be a relatively mild to moderate illness, something non-life threatening. So please treat at home and call your doctor. Best ways to prevent this. So, of course, we've talked about social distancing. Schools are closed. Non-essential businesses are closed. Things that are open are your grocery stores, the gas stations, the pharmacies, hospitals. Here in Pennsylvania, all elective procedures are canceled now. So I was actually supposed to have surgery in March. I'm not having surgery anymore. It was not, life threatening. It's an elective procedure. So, it's a wait and see now. So again, do not go anywhere unless you absolutely need to. Social distancing is your best practice right now. I'm a runner. I've had a lot of questions from my runner friends about what to do with group runs. Don't go in group runs. Run by yourself or run with one other person that you've already been exposed to during this period. You don't want to, even if you're running in groups of 2, you don't want to mix up who you're running with, because that person has been exposed to a whole other group of people, and the next person is exposed to another group of people. So you want to stick with either solo running or running with just one singular other person for the time being. And if you are running with another person, maintain that 6 feet of distance. Runners are notorious for spitting or shooting snot rockets. You don't want to do that near your running partner. Those are great ways to spread that virus if you're possibly incubating it. Obviously, getting outside is great, though, because it's a ventilated area. It's great for mental well-being as well as physical well-being. So there's no discouragement of going outside right now. We just have to be very cognizant about staying away from other people. I know that, people had questions about the playgrounds. Children should not be on playgrounds because you don't know the last time that was cleaned, first of all. Even if you're wiping it down, it is very likely that you're not wiping everything down off of that. Not to mention the fact that your children are now interacting closely with other children nearby, and they're all basically exchanging germs. The schools have closed for a reason, not to send your kids to a rec center for a day camp. That defeats the purpose of the school closures. The data right now suggests that generally elementary age children are among the least affected by this. However, they can still be a point of transmission for high-risk populations, elderly, people with immunocompromised conditions, etc. So just because your kid isn't physically ill doesn't mean that they might have picked something up and could pass it along to someone else. Beyond the social distancing, hand washing is key. So hand washing, you're going to be sick of hand washing by the time this is over. It's great practice to do in general. Everybody should be washing their hands. If nothing else, now everybody is washing their hands. You want to wash your hands for 20 seconds at least. So, the recommendation is singing happy birthday. There's a list on Facebook of some other songs if you get sick of singing happy birthday. If you want to be more scientific about it, you can time yourself. That's often what I do. I take a peek at my watch and I kind of see what's going on. 20 seconds. This includes your thumbs. A lot of people forget to scrub their thumbs when they're washing their hands. They kind of do this and they kind of do this and then you're done. You want to do your thumbs. You want to do vigorously with your fingernails. You want to get a lot of friction in your hands. You want to go in between your fingers. You want to scrape under your fingernails. If you can cut your fingernails, just cut them, because then you have less fingernail to worry about, things getting trapped in there. You want to make sure you get all of those points of contact, and you want to do that with a lot of friction and a lot of soap. 20 seconds is the recommendation because that's about how long it should take you to cover all of the surface area of your hands thoroughly. If you're rushed and you get 10 seconds is better than no seconds. So wash your hands, try and do it for at least 20 seconds as often as you can. The soap is the crucial part here, the soap and the friction. So soap acts as a detergent. And these particular viruses have what we call a lipid envelope. And this is basically like a fatty outer layer on the outside of the virus itself. And so if you think about when you have a grease spill in your kitchen, if you spill some olive oil on your counter, things that break it up are detergents. And the reason for that, I won't get too much into it, but basically detergents are specific molecules that are able to disrupt those fatty bonds. And they'll basically, in the case of the virus, once they disrupt that, it's going to basically kill the virus. It will also dislodge any potential virus that's still kind of hanging out on your hands, and ultimately will wash that down the sink as well. So soap here is the crucial part. You want to, any basic soap. You don't need antibacterial soap. Antibacterial soap is useless against a virus. And actually it has some other negative consequences for your healthy bacteria that live on your hands in general. So your basic liquid soap, your basic bar soap, those are your best things to do. If you're not sure what soap to go for, two main detergents that are most common are going to be a molecule called sodium lauryl sulfate or sodium dodecyl sulfate. Those are common detergents that are in most of your usual suspect soaps, and those are good things to look for. If you don't have access to soap and water, then your hand sanitizer will come into play. And your hand sanitizer, you're aiming for at least 60% alcohol based. 70% is ideal. Most commercially available hand sanitizers are between 62 and 65% alcohol. So those will work in a pinch. Soap is preferred, but the hand sanitizers will still kill the virus that's on your hand. They're not washing anything. It's kind of a temporary solution until you get access to soap and water again. Other than that, I often will clean surfaces around the house or clean surfaces. I had to work in New York City last week, and now it's a hot zone. And I had to valet park my car where the lab I was at. And so after I got back to my car, I wiped down everything. I wiped down the door handle. I wiped down the steering wheel. I wiped down the shifter. I wiped down even the front console. I have some sanitizing wipes with me. That's a good practice if you're going to be, interacting with other, like if you have to bring your car to the shop during this time period, just assume everybody's infected and you want to just wipe everything down. The virus can survive on surfaces for a period of time. So, at the maximum, and this is in absolute ideal conditions, we're estimating about 3 days on a surface. And that's going to be particular surfaces like steel or glass. On other surfaces like a cardboard or a paper or things like that, it's far, far less. And again, the data that was collected is in ideal circumstances. So we have to assume also in real life, it's going to actually probably survive a little bit less than that. Good practice, though, if you're concerned or if there's a concern that surface has been contaminated, you want to sanitize that. And best sanitizer for surfaces are either alcohol-based or bleach-based cleaners. So your Clorox or things like that. If you don't have access to those, you can also use hydrogen peroxide in a pinch, and that will do a good job. And then again, if you don't have any of those, you can use your soap and water again and just scrub that surface really, really well, and then rinse that off cleanly. Okay. That's kind of an overview right now. If anybody has any questions in the chat box, I can start to kind of address some of those.
Andrea, that was great. Is the clicking still going on? I moved to a different room.
But I can hear it, but it's not too bad.
I have no idea what it is, but so that's a mystery. I'm just gonna go with blame it on the fish. So that was really, really helpful, and I really appreciate that. Now I had seen because we're friends on Facebook, and I follow everything that you write about everything that's going on now because I'm a nerd. Did you write something about doing some work on this and trying to do some research on COVID?
So yeah, there's some labs that we collaborate with at my company that are currently working on developing some therapeutics. So a lot of stuff has been in the news about the malaria treatments, your chloroquine and hydroxychloroquine. Those have also been used to treat autoimmune conditions like rheumatoid arthritis. They do have some potential beneficial data behind them. Now, I would not view that as a cure-all because these molecules, these treatments have very severe side effects. It's one of the reasons why we have some alternatives for malaria treatments now, aside from the fact that the malaria parasite has actually evolved resistance to them. But there are other things that are in the pipeline. So there are some, we call them immunotherapy drugs. And basically what they do is they interfere with your immune system. So the reason we get these symptoms, the pneumonia, the respiratory distress, the fever, A lot of it is because your immune system is trying to fight this virus that's now in your cells. So the virus generally infects cells in the respiratory tract. So it's epithelial cells in your upper and mostly your lower respiratory tract, alveolar cells in your lungs. It can also infect certain cells in your GI and your excretory system. So kidneys and your GI tract, mostly your ileum and colon. But the reason we get these symptoms is because your immune system, which is filled with these white blood cells that are kind of primed to fight against these unknown invaders, are signaling to other immune cells to basically recruit them for battle. And some of these chemicals, some of these signals that they're producing cause inflammation. They cause fever. They cause some of these fluid buildup. They cause some of these symptoms. So it's not simply just because of the virus itself. It's also because of your immune system mounting this response. So some of these immunotherapy treatments that are actually being developed right now and are actually in phase 2-3 clinical trials are things that actually interfere with that immune response. And so they kind of help dampen that excessive inflammation so that your body can then fight this a little bit better. So we've got some options right now. They're all obviously in clinical trials. I believe the chloroquine and hydroxychloroquine has just been FDA approved for treatment in the US. We've also got some other therapeutic antibody treatments, and they're actually working on it's called a temporary vaccine. But basically what it is antibodies produced by someone that's recovered from the virus. They produce these protective antibodies. That's where we get this long-term immunity from. And they're basically trying to develop a way to isolate those from people that have recovered and be able to treat people with that. What it would do was it would treat the current infection that they have, but it obviously wouldn't give them, immunity to it. They would have to recover themselves as well. So we've got a few options right now on the table. They're all in clinical trial. But I'm hopeful that there's going to be some very promising data. There was a trial that they tested some really late stage respiratory distress patients with an AIDS treatment condition, an AIDS treatment medication, and it actually did not confer any benefit. So that one was kind of tabled for the time being. But the rheumatoid arthritis / malaria treatment, and then also these therapeutic antibody treatments that will be coming out hopefully by the summertime for actual public consumption. So that would actually be a much shorter time frame than a vaccine itself, which is still probably going to be about 12 to 18 months away. But if we can get some treatment options to work with the more severe cases, then we can limit that hospital burden, that healthcare system burden, and free up resources to treat and potentially test other people as well. All right.
Looks like you have some questions.
You have some questions. All right. So let's see.
A Giardia one.
Yeah. So if someone suspects they have a Giardia infection, should they go get checked? So that's a great question because, of course, we're talking about not going to the doctor unless you need to. Now, if you are ill, Giardia is a parasite. Giardia can make you severely ill. I've gotten it not recently, but as a child many times, and it is not pleasant. It can get very severe. What I would do is I would call your doctor, see what they recommend. It's possible they might try to do some remote medicine for the time being, meaning do a diagnostic remotely, and they might actually go and prescribe the antiparasitic for Giardia in the time being. But best practice for anything that's a medical issue that is not COVID, call in advance and they'll hopefully be able to direct you. A lot of medical facilities are trying to physically separate people, so they might be able to send you to a facility that they know is clean and you don't have a risk of contracting COVID while you're there. Azithromycin, they're currently using that in combination with the malaria treatment. Azithromycin is an antibiotic. By itself, it probably wouldn't do a lot. They're still working on the mechanism as to why this happens to be somewhat of a promising combination, but there is some data coming out of France right now that suggests that this combination therapy might show some promise in reducing the severity of symptoms of people with COVID. So aside from your immediate family, is it okay to interact with family you don't live with? So my general recommendation is don't right now. It's really unfortunate. It sucks. FaceTime people, do a Zoom, I'm doing a virtual lunch with a friend in Texas next week. So we're both, working from home on Wednesday, and we're going to take our lunch breaks together and we're going to chat over FaceTime. Um, you know, right now, other than your immediate family unit, you want to limit interaction with anybody else, even if they are your other family members. Particularly if they're older than you, they might be higher risk. You might have picked up something from your store down the road and you could bring it over there. So the goal is to really isolate yourself as much as possible within your house, and interact only with the very few people you have to when you have to make a run to the store. Oh, so the Costco employee. So there was someone who tested positive for COVID-19 at the Costco just down the road from me. If you're having groceries or other items delivered to the house, it's a great question. I've been talking about this with a lot of people because I know a lot of food businesses are shutting down. They're only allowing takeout or delivery. A lot of people are hurting in the economy now. We want to try and support them, but also we have concerns about bringing contaminated items to the house. So my recommendation, there's been no evidence of foodborne transmission of this yet. The only concern would be the packaging itself. So my recommendation right now is, if it's a plastic packaging, so say you get like one of those hard shell cases of produce or lettuce or whatever it is, wash your hands. Of course, you want to continue protecting yourself. Maybe wipe that down before you actually start to handle the produce. Generally speaking, this is probably pretty low risk. Like I said, some of these surfaces the virus can survive on, but it's much more short-lived than something like glass or steel. So cardboards, papers, plastics, etc. And that's in perfect circumstances. So generally speaking, by the time a mail piece or a package or something gets to your house, it's probably safe to handle. Best thing for those types of deliveries, though, again, don't do face-to-face handoff with them. Have them leave it at the steps, have them leave it at the driveway, whatever the case happens to be. Anticipated time frame for reopen of non-essential businesses. That's a really hard question to answer. Some of that is going to depend on how the next couple of weeks play out. I just saw this morning that there were hordes of people in DC looking at the Cherry Blossom Festival, all along the water there. People are not taking social distancing seriously. I think in our area, since we've been shut down by Governor Wolf, it's been pretty good, but I suspect it's a little bit too late. So we're going to see an increase in cases. And part of how this gets handled is how stringently people adhere to the social distancing. It could be a couple of weeks. It might be a month. It might be 6 weeks. Last week, CDC recommended no large gatherings for the next 8 weeks. That's kind of the time frame they were working on. And that may actually get revised as things change. So we'll have to kind of just stay vigilant and kind of keep up to date with what the current practices are. It's really unfortunate because I know a lot of people are out of work and a lot of people are struggling. I think hopefully there are some measures for some financial compensation for some of these people in the interim. But hopefully if people start to see how serious this can be, we can implement those social distancing procedures without having to take really, really stringent measures like repercussions or actual fines or things like that, like other countries are having to do. And then we can hopefully get back to normal. Precautions that will still be in place when everyone returns to work. Again, it's a little hard to say because it's going to depend on the time frame of that. If it's a situation where we've actually peaked with regard to number of infected people and we're actually seeing a tapering of that, that would indicate that we've got some acquired immunity to the virus. And that might mean that we can actually loosen up some of these precautionary measures and we might be able to start doing conferences, large meetings, sporting events, concerts, etc. I think ultimately, the goal is to be able to reopen business as usual, but it's likely that that's not going to be for quite a while. We may be able to have limited smaller gatherings, but I think really large scale events will probably be on hold, at least until the summertime. That's the time frame when we're looking at having treatment options available. Can I address whether or not the summer heat will slow it down? That's a great question, and there's a lot of controversy about that. So, seen a lot of people saying, oh, just go in the sun, it'll kill the virus, you're good, no worries. So, generally speaking, other viruses that are respiratory in nature, other viruses somewhat related to SARS-CoV-2, have shown some weakness in the heat and in the sun. And that is going to be true here as well. However, we are seeing cases all over the world. We are seeing cases in Africa. We are seeing cases in Florida where it is in the mid 80s and it is 100% humidity. So it doesn't mean that you go outside and it's going to kill any virus that's sitting on your body. It's certainly not going to kill virus that's already infecting you, because that's already in your system, that's already in your cells. There's nothing you can do about that. There is some hope that as the UV irradiation from the sun starts to get more intense, now that we're moving into the spring months, that might help or limit the persistence of the virus on surfaces. So it might slow down the transmission rate of it a little bit, but it's not going to eliminate it outright. Studies in the lab, have shown that the virus can survive or is inactivated at sustained high temperatures. So this is above 55 Celsius, which is about 130 degrees Fahrenheit. And at 15 minutes, everything is killed. You're going to see some killing effect at lower temperatures and for shorter durations as well. But you don't want to make the assumption that it's just going to get killed off once the weather gets warm. On the cold side of things, it can survive in a minus 80 Celsius freezer for months. So the cold is not going to do anything to help that. And that's true for a lot of viruses. They essentially just kind of shut down their metabolism and they're able to basically be reactivated. All right, so if you have a fever and you don't have Tylenol, what should you take to lower fever? Cooling baths or drink cold water? That's a great question. So there's some chatter about how the mechanism of how the virus infects you is through a molecule called ACE2. And this molecule, there is some evidence that suggests that taking other sorts of NSAIDs, such as ibuprofen, brand name Advil here in the US, can actually increase expression of that molecule on your cells. And so there's a theory that might make you more prone to infection or might make your illness more severe if you actually were infected. Now, there's no data to say that is in fact the case, but some public health facilities are recommending staying away from NSAIDs for the time being until we have more data. My general recommendation, if you don't have Tylenol, cold baths, cold compresses, those will help. If you only have an NSAID like an ibuprofen or an aspirin and you're homebound and you're socially distancing and all of that, I don't think it's going to, and you're a mild to moderate case, let's say that, let's take the caveat that you're mild to moderate, moderately sick. I don't think that the data is strong enough to suggest that will harm you. I would say ibuprofen should be your last resort. So go with maybe if you have naproxen, so that's Aleve, or if you have aspirin, maybe take those first. If you don't have any of those options and you want to stay away from the NSAIDs altogether, cold baths, cold compresses, things like that will kind of lower your fever. And obviously Tylenol is a safe bet right now. Working is fine as long as you're practicing good social distancing. So if you are physically still going to your work because it is considered to be an essential business, social distancing is obviously the best thing to do right now. I would say stay away from common areas. So don't eat lunch in the common lunchroom if you have one. Try and clean off your desk. You want to make sure to wash all things that other people might have touched. So that could be your keyboard, could be if you're sharing, if you have a phone headset or headphones, or hopefully you're not sharing headphones, but there are some common pieces at office buildings or other institutes that might be shared. So those things you would want to wipe down before using, probably even after using, just in case for the next person. wearing gloves to go inside the building to limit, touching the handle of the doorknob or things like that. You could do that. You can also take like a paper towel or things like that to hold that. Because PPE are at such a premium for healthcare workers, I would say let's try and not use PPE for just getting into a doorway. Maybe have some napkins in your bag and you can use that to hold the handle. Again, washing hands before and after anything that a lot of people might have touched is best practice as well. As long as you touch something and you wash your hands before you put it near your face, you're going to be safe. It's not going to get through your skin. So that's basically your best practice there. A big reason many young people are not taking this seriously is that everyone's saying that young people are only going to have mild to moderate symptoms. And that's definitely giving people a false sense of security. New studies showed that about 54% of cases that are being hospitalized or considered more severe are under ages of 54. And so it is not exclusive to elderly people or people with pre-existing conditions. It can affect everybody. There's been several cases this week of unfortunate fatalities from young people. Several young mothers, other young people where the whole family had gotten infected, and there were several fatalities there from a family gathering. Again, why we're saying socially distance yourself. And, especially in kind of that college age group, they have a little bit of that sense of, invincibility. And so I think one of the things is that perhaps certain people were a little bit too cavalier in talking about the severity of it. Certainly, if you look at the whole scope of everybody that's gotten sick, the majority of them are mild to moderate, but it doesn't mean that it's only going to be severe in this one class of people, this one age group, this one set of people with, pre-existing conditions. It can be very severe for people of any age ultimately. And I think that's something that we have to get clear. The range of mild to moderate, mild to moderate can include mild pneumonia. It certainly can. Once it progresses into more severe pneumonia, which we call acute respiratory distress syndrome, that's really when it's going to be kind of shifting towards severe/critical. The final stage, unfortunately, is what we call cytokine storm. And that's basically when your immune system just gets out of control and it starts producing all sorts of inflammation in your lungs, and you're basically kind of drowning from the inside out. And there's really not a lot that can be done at that point. So we want to try and limit the number of cases that get to that point by taking all of these precautions. If you are progressing to a more severe situation where you're struggling to breathe, you have an unrelenting cough, things like that, that's another opportunity to call the doctor and see if they can recommend, they might need to put you on oxygen. They might need to put you on some other measures to kind of help with those symptoms. And that obviously would be something they would still, you would qualify for a true test to really verify that. The test right now is currently a PCR-based test. And what that means is it's testing for the genetic material of the virus. So what it's testing for is whether or not you have virus in your nasopharyngeal tract. There's a recent study that just came out. People are trying to work on diagnostics to test for antibody production, because that's a sign of acquired immunity. And that will be able to give us information about who actually had it and has recovered. And that will also give us some insight as to herd immunity of the population, because herd immunity will ultimately protect those that haven't gotten sick yet as well. So we're hopeful that will come sooner than later. Regular physicals, if your doctor's still having office hours, if you can postpone it, I would postpone it. There's no reason to go get a physical right now. There's no reason to expose other people in the doctor's office. I had an orthopedic surgeon appointment. I postponed. My physical therapist office is canceled. I'm not, unfortunately not doing anything right now. I postponed an annual GYN exam because there's just no reason. Those things are not life threatening. It's better to be safe now and wait a few months. I got the same question about childhood immunizations about last week. A mother was wondering, should she still bring her kid in for their next round of childhood immunizations. And I said, if you wait 2 months, wait 3 months, it's in the grand scheme of things, they're still going to get that protection from those immunizations. And it's better than potentially risking exposure in the doctor's office. There's a reason, at least in Pennsylvania, they've halted all elective procedures. And that's basically first to obviously limit exposure of people there, but also to offload burden on the medical institutions. We want to save those doctors for when they're really crucially needed right now. All right, research on how it impacts pregnant women and the fetus. So there's been a little bit of data. It's really hard to say right now. Right now, there's no evidence of what we call vertical transmission, meaning that the fetus can actually get the disease from the mother, which is good news because there are many things out there that can be vertically transmitted and can cause spontaneous abortion or miscarriage. As of right now, with a pregnant woman, they can be somewhat immunocompromised because obviously they're growing a human being inside of them. They often have some, nutrient deficiencies and things like that can make them more prone to getting ill. So they might, I want to say might because there hasn't been any data suggest that they're any more high risk than anyone else. But there could be some risk associated with it. So again, you want to practice just the same social distancing measures, hygiene measures and things like that. The data so far, there were some pregnant women, especially in China, that did get sick. They didn't have any complications in pregnancy. They didn't have any miscarriages. They didn't have any long-term sequelae from that. So that's very promising. But of course, the sample size isn't terribly large. So we just want to be careful. If you are pregnant and you suspect you might be sick, again, call your doctor and call your OB as well. About the elderberry product. So elderberry is one of these mythical cure-all compounds, supplements, whatever you want to call it. Supplements don't do anything. If a supplement was effective, they would be an actual medicine. They would be an actual prescribed indication for them. There's a lot of chatter about boosting your immune system or things like that. You can't boost your immune system. Your immune system is a set of organs and cells that function as a unit in your body. So taking supplements are not going to either help or hurt you ultimately. They are pretty much, expensive urine. It's sad to say, but supplements just don't do a lot for you. There are certain medical conditions where a particular supplement is in order because of some sort of actual deficiency. But all of your minerals and vitamins and things like that, you're generally getting from your everyday diet. With regard to elderberry, it likes to tout itself as a miracle cure for the flu and for the cold and things like that. There's no data whatsoever that suggests that it can do anything beyond helping to alleviate some symptom severity. And with regard to COVID-19, it is not influenza. There's been no data whatsoever that elderberry is either helpful or detrimental. If you want to take it because it makes you feel better, that's fine. Placebo effect is a real thing. But yeah, I wouldn't worry too much about that. All right. Any other questions?
So I had a question, Andrea. Why do we have a shortage of testing stuff here in the United States? Because it seems like in other countries, they're just like handing them out like willy-nilly. And yet here, people have had to wait. We have to go through this process of determining whether you qualify for one. And then when they're given, we have to wait a period of time. And it seems like in other areas, maybe it takes less time. So what's going on with that?
That's a great question. And there are several failures here. So there's been obviously a bit of I'm trying to be diplomatic here, but there's been some failures on the part of the government with regard to acknowledging that there is a legitimate problem. We had officials high up that were denying that this even existed until it was almost too late. So globalism is a great thing. Globalization is a great thing. Allows us to interact with, and especially on the science side, collaborate with people all around the world. You can fly around the world in a day. But it brings with it diseases. It brings with it all sorts of things because now those diseases are on a plane flying around the world. And so these sorts of pandemic or epidemic type episodes are going to happen more and more frequently if things aren't done or aren't put in place to address them. And a lot of that is because of globalization. It's because as a population, we're somewhat overpopulated and things like that. So the more close proximity you have, the easier these things travel. So initially, there was a bit of a denial and a delay in starting to develop US-based test kits. Then there were some quality control issues with the first batch of test kits that were created. And then there was some miscommunication with regard to who was actually going to be developing the test kits and who was going to be distributing them. And all of those things kind of snowballed into a very delayed and a very limited supply of test capabilities. Only now are we actually starting to get tests, and it's still not enough. We still don't have enough tests to test people, but more than that, we also don't have enough PPE to test people. And so it's just this kind of avalanche of, factors that have played into why we don't have these resources available now. The first batch of tests were pretty much unusable because the controls weren't working properly. And so all of those had to be junked. And then the developer at the CDC, they were requiring all the tests to be sent there, which then leads to a time delay in terms of, and a throughput delay where they only had the capabilities to test a certain number of samples at a given time. And then, when other labs around the country finally got the capabilities to, we're still at this lack of resources because now we have more and more cases, and we're still, again, limited on those tests.
So today I had to go to the post office. So when I went to the post office, I grabbed a glove to open the door and go into the post office and then leave the post office. What do you suggest for normal, like if I need to go to the grocery store, what is the safest bet there? Because the grocery store is the place where like social distancing is really hard to maintain. And like I was at Wegmans last weekend and I was like, this isn't really happening. So what are your thoughts on that?
Yeah, it's a great question. And I think it's something that everybody's still trying to figure out because, of course, we still need food. My first recommendation is try and stock up for at least a week or two so you don't have to keep going to the store every other day or every day or whatever the case happens to be. Of course, you're still ultimately going to have to run to the store every now and then. And so some stores have implemented limiting the number of customers at a time. So some people are only letting in 10 or 20 customers at a time, and then they're kind of rationing how many people can access the store, so you can kind of maintain that social distance. Some stores are actually preventing you from interacting directly with the cashier, so they're having you put your things on the conveyor belt and you're stepping away and you're kind of doing this sort of exchange remotely. I know Wegmans has hand sanitizer stations upon entering the store. That's a great option because, of course, you're going to wash your hands before you leave your house, but then you've driven in your car and you've gotten there and you've kind of grabbed your cart and all that. So hand sanitizer before. If everybody's doing that when they walk in the store, at least their hands will be clean. Obviously, we can't eliminate the fact that people might be, breathing or, hopefully no one is visibly coughing in a grocery store. That would be obviously cause for concern. But sanitizing your hands before you go in, washing your hands when you get home, trying to limit, if you see a crowd of people around a certain area in the store, maybe go to the different section before going back there. And just being really cognizant of who else is around you is really the best thing we can do. But of course, reducing how many times you have to go to the store is the best measure. And then, of course, trying to stagger it on times where it's not going to be quite as crowded is also a great option. If you have symptoms at home that you suspect you're mildly or moderately ill, if you don't have a fever, can you develop pneumonia? So yes, ultimately, fever is the most common symptom in about 88% of cases right now, but you can also develop the other symptoms or have other symptoms without a fever. It's not very common, but it is possible. So if you did have some of the more severe respiratory issues, you could ultimately develop pneumonia without having or presenting with a fever. If you suspect that you're mildly or moderately ill at home, best thing to do is taking your Tylenol, so that's acetaminophen, drinking fluids, getting lots of rest, all of those things that are going to allow your immune system to do its job. So the big thing you want to do is, your immune system has to fight this battle. And so you want to basically reduce any additional or outside stress on your immune system at the time. So getting lots of rest, eating nutritious foods, staying hydrated, taking fever reducing agents such as acetaminophen or Tylenol. That's the best one right now. If you do have a sore throat, which has happened in a few instances, of course, you can take lozenges for that, whatever's going to kind of help feel better. Symptoms typically last, it can be, if it's a mild or moderate, it can be as short as a week. If it's a severe, if you develop a pneumonia or things like that, it can actually last, 6 weeks potentially. So some of that depends on how sick you get. The rule of thumb right now is if you had a fever, if you have visible symptoms, you need to quarantine yourself and not leave your house until at least 48 hours after those symptoms are gone. The studies have shown right now that the virus can be infectious for 8 days after symptoms first appear. And so if you're saying it's about a mild or moderate illness, if it's gone in about a week, give it another 48 hours before going back into public. If you have someone else, or if you can get food delivery in the interim, just don't interact with people, stay homebound, don't go outside at all. Just, keep yourself quarantined for that time being. Your mother's on oxygen and immunocompromised, point of contact. That's a good question. It's a really good question. And it's great that you are doing that to help your mom. When you deliver her food, it's a hard play without knowing who you've interacted with. The safest bet is really leaving them at the door if you can. If not, if you do have to go in and you have to organize things or put certain things away in certain places, just practice those social distancing as much as you can. Make sure you wash your hands before you interact with her and after, wipe down those surfaces that you might have touched. Just try and keep her as healthy as possible while, also being able to provide her that really helpful service. I'm sure it's very hard to not want to go and give your mom a hug when you see her to bring her food and stuff, but just try and avoid that for the time being. 6 feet away is best practice if you do have to go inside.
So my clock is telling me it's 3 o'clock, but like really, it's got to go like right now. So I've heard though that there's going to be waves of this. So like there's going to be a big wave, and then it'll kind of go into a lull, and then be another wave of them.
Yeah, so part of the flattening the curve.
So you do see it progressing like that, so that's why it'll go.
Right, and that's kind of it's expected. And what's going to happen is you'll flatten the curve, you'll alleviate some of the hospital burden, and then what will happen is you'll have some people that are starting to develop immunity from this. And so each potential wave will be smaller and smaller because you're going to accumulate people that are now developing immunity to this. And so it's delaying the total case burden by doing this in kind of stages. Now, ultimately, the goal would be if we have a treatment or, hopefully a vaccine or something, we can actually eliminate some of those future waves. But if we can basically make those smaller, more manageable, then it's going to be a lot less detrimental on general population health, on hospital and healthcare burden, and on total caseload as well. And that could also, reduce our total case fatality rate as well. We're already seeing, at least from the data we have in the U.S., that the case fatality rate of cases we know of right now in the U.S. is much lower than in Italy. Italy has one of the highest right now, and lower than even in China as well. Now, of course, we might not be capturing all the cases, but if we But if we aren't capturing all the cases, that means that our fatality rate is even lower, because that means our total caseload is even greater, which is the denominator in that fraction. So being able to delay it so that we can actually give appropriate medical attention to the severe patients will actually give us better health prognosis.
So this has been very informative. Do you think that there's anything else that like the government can do that they're not doing that we could expect to come down the pike as this goes forward, or like have we done enough? I mean, Governor Wolf has been pretty like out there pushing things more than other governors have.
Yeah, agreed. I think he's doing a great job. I think the big things we need are PPE right now. So if whether that's national, whether that's federal, whether that's statewide, if there's a lot of places that have the ability to manufacture PPE, provided they have resources to do so, that would enable us to not only protect our healthcare workers who are without PPE, but also be able to increase testing. And if we increase testing, that will give us a better way to model what this next phase of this outbreak will be. So having better safety precautions, better or more safety precautions, more PPE for healthcare workers, for even general population, if we get enough of it, that's really crucial, in my opinion. And there has to be obviously an economic stimulus, to actually drive that, which is part of it. Other than that, it might come down to actual mandates with disciplinary action for social distancing. It might turn into a lockdown scenario where you need a pass to leave the house. I'm hoping it doesn't come to that. I'm hoping that people will have a little bit more, awareness of how serious this can be. But we are seeing it in Europe everywhere. China did a very strict quarantine, and they were able to limit the spread after that really pronounced initial outbreak. And we have an office in China, my company does, and they're projected to be basically allowed out in April, but they've been in quarantine since January. And it's hard to kind of reconcile that with the way of life you're used to, but people are not taking it seriously. So I think those are the two big things for sure.
So do you have anything that you'd like to say to the naysayers who are saying that this is a hoax and this is like, the Democrats trying to ruin somebody, I mean, I'm not, because there are naysayers out there. I mean, and this is about my parents. This is about your parents. This is about my kids. This is, I mean, my mom and dad are, my mom just turned 73 yesterday, and my dad's going to be 75 this summer. And so they're at an at-risk category just because of their age, and I would like them to stay around a little while longer because I do actually like my parents. So, what can we do to say, I mean, yes, you and I are setting an example here, right? We were going to do this Facebook Live and practice social distancing, but then we decided to take it this extra step because as being a leader in the medical facilities, medical world saying, we need to do this, and me running for state representative, we need to be leaders, right? So we move to this step. So what can we do?
Yeah, I mean, there are always going to be people that just would not acknowledge reality, and whether that be in the case of a disease outbreak or in the case of climate change or in the case everything that's scientifically proven at this point, there are always people that are going to deny it. And whether that is a personal, hesitation, or whether that is politically driven, it's, unfortunately, there are people that you're not going to be able to get through to. So, from my perspective, it's really about the masses, educating the masses, getting the actual fact out there, dispelling a lot of the conspiracy theories about how to treat it, how to cure it, how to reduce it from spreading. And then hopefully, that will become the majority of the population. And so even if there are these people that are still kind of sitting on the sideline saying, no, this is not real, this is not as serious, I don't have to care, then at least the majority will be able to protect, everybody else.
So one of the things that I've been working on as chair of the Upper Chichester Democrats, I've been working with the chair of the Republican Party in Upper Chichester to move one of our polling locations because it's in a retirement community that's a low income retirement community and the public come in to vote. And so, we would like to move it to respect the safety of those residents and then try and push them to do mail-in voting since that's now an option here in the state. But there are a lot of concerns with the voting and how we're doing it now, that we're going to fill out a piece of paper, put it inside a cardboard envelope to take it over to the scanning machine. We're going to be using a pen and it's going to be a plastic pen. And these are foam lights and possible options to transfer things. And, I think it's going to be really hard for us to ensure safety. A lot of our poll workers are retired folks. They're elderly. They're in that risk population. So what do you suggest for poll workers? What do you suggest for voting safety? I personally think we should go into mail-in voting for the primary and would like to see that happen. But what are your thoughts on this?
Yeah, and it's with ours kind of approaching, there's a tough position, right? Because a decision has to be made. My personal preference is we should postpone all voting in general right now, just like they postponed tax filing day and things like that. People they're not emotionally in a place where they're thinking about that, and just really kind of diverting energy away from surviving right now. I think it's a really volatile time. I think ideally postponing it. I think there's been some chatter about that. I think short of that, mail-in is a great option. And I think most people will try and do mail-in ballots now that we do have that as an option. I was honestly shocked. I have a friend that lives in Chicago and he went to vote last week, in the primary. And I was shocked that they're still having, open polling places in the midst of all this. So I think mail-in is a great next option. I think if there still is an in-person voting option for the poll workers, again, you want to do those same things. They want to be sanitizing their hands, even sanitizing the pens. The cardboard is probably less of a concern. Perhaps they want to have gloves on. I think all of those safety precautions, because they will be interacting with a lot of people, and really just kind of limiting the distance that they're between, the voters that are signing up.
So Andrea, this has been really, really great. I so much appreciate your time. Do you have any final thoughts that you want to leave us with?
My final thought is, it may seem very, very bleak right now, but all of these things we're doing right now will ensure that we can limit this and get out of this as quickly as possible. So everybody try and do the things that are good for your mental and physical well-being, whether that be meditating, whether that be reading a new book. I know I'm still working, so it's been kind of crazy for me, but I got out for a run this morning again by myself. But do those things that give you the little bits of happiness and the little bits of peace kind of in this really, chaotic time of upheaval. And, hopefully if we can get everybody started hearing, we'll be out of this sooner than later.
Yeah, I just had somebody say, thank you so much, Kathy Spar and Dr. Love, can we do this again? So apparently we were entertaining. So I want to thank everybody for, coming and spending your time with us and asking your questions. And I really personally think that Dr. Love should create her own Dr. Love Facebook page, just so people can put information out there and they can follow her without bugging her personal page with questions. And certainly if you guys thought this was informative, in a couple of weeks when we see how things progress, we can talk about doing this again and find out what we've learned in that period of time, because things are moving so quickly.
Things are changing very quickly. Absolutely.
Yeah. It's like an hour news cycle, half-hour news cycle sometimes. So Andrea, thank you so much.
Yeah, absolutely.
You're my hero. And look, ladies, look what you can become. You can be smart and PhD. So I'm going to give a shout out to the women to know that, you know, we too can be doing stuff like Andrea. So, all right. Thank you.
All right. Take care, everybody. Stay safe. Practice social
Thank you.
distancing.
Bye.
Bye.